Every day that passes that we don't act to rein in federal spending and address our entitlement crisis leaves taxpayers exposed to an unacceptable and unsustainable levels of debt. Simply doing nothing is not an option. Let me just refer to this first chart. It's just the way it is. These problems are fundamental and they do not fix themselves. We owe it to our seniors, children, and grandchildren to get off the sidelines and act responsibly to fix this problem. Our fiscal situation is dire. We have now had 3 consecutive years with trillion-dollar deficits, and we have racked up $14.5 trillion debt. For any who doubted the magnitude of this crisis, the CBO confirmed it again yesterday. By 2035, our public debt will rise to 190% of gross domestic product if we do not get spending under control. Now think about that. Greece is currently what, around 150%? We cannot allow this to happen, and right now we're on a glide path to Greece, a path with devastating implications for the liberty of taxpayers and the prosperity of our nation, and perhaps a whole lot of other nations as well. Admiral Michael Mullen has identified our current debt spiral as the greatest single threat to our national security. Now, it's hard for me to disagree with him. I don't. The bottom line is that the storm is gathering, and a commitment to the entitlement status quo is a commitment to senior impoverishment and national bankruptcy. Last year alone, total Medicare and Medicaid spending was $800 billion. The longer we wait to address these programs' finances, the harder they will be to solve. And the time for courage, it seems to me, is now. This year, the first baby boomer will become eligible for Medicare. In 2010, there were 47 million Medicare beneficiaries alone, and by 2031, it's projected that 80 million people will be Medicare eligible. And as these retirees come online, government spending is going to mushroom. Just look at the chart, putting it in perspective. According to this year's Medicare Trustees Report, Medicare is facing a $38 trillion unfunded liability. Now, this number is so outlandish that I need to put it in perspective. And let's refer to this chart here. The median household income is $49,777 per year. The median home value is $221,800 per year, which we all know is the biggest asset most families will ever own. Yet Medicare's unfunded liability stands at an astonishing $353,350 per household. So even if an average family sold their home and gave up their income for an entire year, they would still not meet their share of this one entitlement obligation. And this is simply unacceptable. Today, our 3 major entitlement programs, Medicare, Medicaid, and Social Security, account for 44% of non-interest federal spending. But by 2085, these 3 entitlement programs could account for more than 60%, or 2/3 of the federal budget. Now, we've seen this train coming down the tracks for some time. Yet, given the opportunity to address this fiscal imbalance in a responsible way, the President raided the already busted Medicare program. The Patient Protection and Affordable Care Act increased spending by $2.6 trillion, created new entitlements and expanded old ones, and attempted to pay for all this by stripping Medicare of $529 billion and raising taxes to over $800 billion. Guided by a political philosophy of never letting a crisis go to waste, this law has only helped to accelerate our current debt crisis. To get Medicare spending under control, the President is going to have to lead. He's going to have to put national priorities over presidential politics and address entitlement spending. Unfortunately, the President's solution is to grant power to a 15-member panel of bureaucrats that will decide how to spend taxpayer dollars and to determine what care senior citizens will receive. Now, let me be 100% clear here. The Independent Payment Advisory Board, or IPAB, is not the solution to Medicare's upcoming bankruptcy. As bad as Medicare's financing is, it is only one contributor to the overall growing debt crisis. Medicaid is also a growing problem on the federal and state governments. The Medicaid program has grown far beyond its original purpose of being a safety net for the most vulnerable in our society. Let me just refer to this chart here. As weak as Medicaid's financing already was, the health care law that passed over the objection of every Senate Republican resulted in the largest expansion of Medicaid in history. According to CMS, in 1966, there were only 4 million Medicaid enrollees, but by 2019, there will be 78 million. Almost 1 in 4 people in America will be on Medicaid. That ought to tell you something. And just this week, we learned that the new health care law, through an unintended glitch, will actually expand Medicaid to an additional 3 million middle-class Americans, making up to $64,000 a year. Now, that's some glitch. This mission creep is bankrupting the federal government. Washington will spend $4.6 trillion on Medicaid over the next 10 years. That's a huge driver of our national debt. To put it delicately, the new health care law certainly did not help. The Office of the Actuary at CMS estimates that the Medicaid expansion will cost federal taxpayers $735 billion over the next 10 years. That's just the expansion. And cash-strapped states are also feeling the burden of the Medicaid entitlement. The program consumes nearly 22% of the respective states' budgets today, and things are about to get a whole lot worse. Let me refer to this chart number 4 to point out the Medicaid mandate on cash-strapped states. A joint congressional committee report that I authored with Chairman Fred Upton found that states are estimating they'll have to spend another $118 billion because of this new law. To maintain these expansions will require cuts in other programs like education, public safety, and health services. Many factors will continue to drive up Medicaid spending, such as the onerous maintenance of effort requirements, the administration's proposed rate regulations that set up new bureaucratic hurdles for states to manage their programs, and a court case before the Supreme Court this fall that could lead to a new wave of costly litigation. There is simply no denying the obvious. Medicaid is in need of major reform, and instead of centralizing power in the nation's capital, Congress should set broad guidelines and define budgets, but then empower the states to run their Medicaid programs in a manner consistent with the needs and the values of their own citizens. Entitlement reform is not about cutting providers just for the sake of cutting. Medicare, Medicaid, and Social Security face real problems that demand structural changes. Our citizens need these changes, and the markets are demanding them. Last winter, I heard a Democratic House member state that the Republicans won in November, and therefore it's their job to fix entitlements. Let me be very clear. It's all of our jobs to fix entitlements. And history will not look kindly on those who stood on the sidelines during the central debate about the very future of this nation. And so, Senator Box, I want to thank you for convening this hearing today. I really do look forward to hearing from our witnesses and have a serious discussion about the need for meaningful reform, and I appreciate it.
Thank you, Senator, very much. I appreciate that. Before I do so,